What happens if you take too much Retatrutide? So I had one of my best friends, he called me up and he said, oh no, I've done it again. I read the wrong dose from the pharmacy. And so I said, how much did you take? And he essentially doubled up the amount of Retatrutide that he took. You know, it was on accident. A lot of people, we see them do this on purpose. They want to speed up weight loss. They jump into the clinical studies and they're like, wow, the people who lost the most weight are doing like 12 milligrams a week. Just think about like when you double up your dose, there's going to be some consequences. And usually those are in the form of gastrointestinal issues. And you'll also see a possibility of a heart rate spike. And so this dose escalation, what it means is please read things very carefully and do not get peptides from research use only sites. Make sure you're working with compounding pharmacies, working with a doctor who understands peptides and uses only 503A compounding facilities. What they found in the phase 2 obesity trial is that the GI toxicity is dose related, but where it comes in play is when the dose is escalated too quickly. So you want to have a nice titration arm in your process. And yes, people will read labels wrong. And yes, Retatrutide, there's still a lot we don't know about this. But what they found in the study is they found nausea, diarrhea, vomiting, constipation when they did the fast escalation. So they did the 8 milligram arm. That's where they found that when they escalated patients to that 8 milligram dose, that's when about 50% of them had a major gastrointestinal event, and a lot of them actually wanted to get off the trial because of this. But what they found is if they started at a lower dose, like 2 milligrams versus 4 milligrams, that was able to mitigate a lot of the effects of most of these participants. If you're thinking about, man, I've already done it and I don't know what's going to happen, and you found this video because you took too high of a dose, maybe you're like my friend and you read the end result, like here's the dose we want you to slowly escalate up to, and you just jumped on that. Well, make sure you keep your body calm. Make sure you're doing things that can actually stimulate your digestive system, because you can activate this. And what Retatrutide is it's a triple agonist. So this is where you've got the GLP-1 receptor agonist, you've got GIP, and you've got glucagon. These three peptides work really well together at increasing your body's utilization of energy. That's the glucagon, working on the liver pathway. It helps with fatty liver disease. You've got the GIP that slows down gastric emptying, but it also shuts off a lot of the inflammatory cycles. It's cardioprotective. Every organ in your body makes GLP-1. A lot of it's made in your gut, and a lot of it's made in your brain. But when GLP-1 is active, your brain gets that reward system turned off. So your brain says, oh, Regan's full. He doesn't need any more food. And that's one of the beautiful things about this is it turns off that food noise. The GIP, what this is it's magical, because in Retatrutide, you've got about 8 times more GIP than you have in tirzepatide. And so this higher amount of GIP helps stabilize blood sugar, because what glucagon is doing is it's slightly increasing blood sugar. So it pushes glucose into your blood from your liver. And when you're doing that, when you're pushing glucose into your blood, if you're not using it, which fortunately with that turning on of what's called PGC1 alpha, these mitochondrial biogenesis in your liver, now the mitochondria need that energy, but you also want to be more active. And part of what increases the heart rate in Retatrutide, so maybe some of you have noticed that, I'd love to hear it in the comments, but Retatrutide will increase your heart rate by roughly 7 to 10 beats per minute. And that's not uncommon. So if you've dosed it too high, you're going to want to watch your heart rate. You want to do things that help activate energy. So making sure you're exercising every day, going for a walk frequently, have some exercise snacks throughout the course of the day. That means every couple hours, get up, do some jumping jacks, do some air squats. I've got a whole fitness protocol for you longevity enthusiasts. It's called Fitness 50 at Age 100. And these are 11 benchmarks that I created for one of my mentors, Dan Sullivan. He's coached more entrepreneurs than probably anyone on the planet. He's 82 years old. His goal is to live to be 156. max. And so he wanted to know what a fit 100-year-old would need to be doing that a fit 50-year-old could do. And that's where I created the Fitness 50 benchmark. So you can find that online. We'll provide a link in the show notes. But look at these 11 exercises. Do a couple of those. They take 50 seconds, most of them. But you can do those on an exercise break. But it's really good. If you're moving your body, you won't have as much nausea, and you'll actually be able to utilize a lot more of that mitochondrial activity, and it will help keep the heart rate more stable. The other thing is making sure that you're eating. Even though you don't want to eat, if you've done a high dose, it's really important to eat some foods that are easier to digest. So in Chinese medicine, we use this overcooked rice. It's called juk. And that overcooked rice is like a porridge, and you just slowly eat that, and it helps calm the stomach. It soothes things. And so if you can eat that with some protein, you can put in some chicken, put in some bone broth, take your collagen, because collagen and bone broth can be really nice on the gut. But you just want to take care of your body as if you had some kind of flu, but not in the way where you want to rest. You want to actually have more activity. But the biggest risk that people have is when you drop into this hypoglycemic level because you haven't eaten anything. And so, yes, I know I said glucagon will help push more sugar into the blood from the liver, but you want to use that sugar as an energy source. You're not losing muscle. That's the real thing. But if you're not eating, then that can be a problem, because now your blood sugar levels can go too low. Now, maybe you just want to do a fast for a couple of days, make sure you stay very hydrated. But the problem is when you start using GLP-1s and when you start losing weight, you're going to lose sodium. So just make sure you're adding electrolytes back into your body. Otherwise, that rapid heart rate can turn into some kind of like arrhythmias or tachycardia. So be very careful there. Once again, call your provider. This is not medical advice. This is me sharing with you some things that can really help. But if you do have that deliberate or accidental intake, maybe you exceeded the therapeutic dose that your prescribing provider put you on, then don't panic. Just make sure that you are eating frequently, so you're not letting your blood sugar drop. Make sure that you're getting plenty of exercise in, moving your body. Make sure you're eating foods that are easy to digest, like the juk, different proteins, the bone broth, the collagen. Those are going to be really important, because the big issue that you have is that gastrointestinal side effect. And that's what they found in the study that I referenced before. That phase 2 study roughly had about 338 adults. And they found that if they escalated the dose more slowly, there are far fewer side effects. People felt better. They were able to recover quicker. They still lost the weight. It just took a little longer. So be patient on this. I have another video called Why Am I Not Responding? And it's, basically people are so concerned about in that first 30 days wanting to lose weight on GLP-1s, but that's not what they're designed to do when you're taking them more holistically. So in our model, we want to provide the real science. So make sure that you do not use this without having a prescribing provider on your side, somebody who understands and is trained in peptides. And then the second thing, make sure you're getting them from a 503A pharmacy. That helps you mitigate a lot of the risk. And then for those of us who don't like to read instructions very well, I love you guys, and just start reading instructions just a little bit. Just take the time to read the instructions. You'll be happy you did. And I appreciate you being on the channel. For those of you who love the video, leave us a comment. Let us know what you'd love to learn and what you'd like us to research. And then subscribe to the channel. Really appreciate you being here. I'll see you in the next video.